Yes, Derek. Yeah, there I can get you clear. Yes, I'm getting you. Your network was totally poor and the links were failing me. Now it's better. Okay.
Leave it on and then they'll watch it.
Yes, yes. Yes, it is true.
It's the real. So I know that but we are like introducing yourself. Yes, please introduce yourself and then
Okay. Derek, you're going to do for me like this. If you're really I'm really audible, if you can really hear me as I'm introducing myself, is it okay? Okay. So I'm Dr. Kasango Joet, and I'm happy to be here. Uh, sorry for the delay. The internet has not been good for us, but we hope we shall discuss what we want really disturbing us because of the network. Uh, as you know, my brother Derek has always been teaching us on sickle cell disease. And once you like and subscribe, you'll be able to watch the previous video on our channel. So today we are only going to look at some of the health tips those people living with sickle cell disease, the sickle cell warriors can use to help them live a happy life. Because as you know, that sickle cell uh, is one of the inherited condition that we really get from our parents, you know. Sometimes our parents are carriers, so they don't know if they have sickle cell because they are not affected anyway. So, because our parents didn't bother to go for tests, we end up getting a child who is having sickle cell. So, in so doing, these children or people living with sickle cell disease really get a lot of challenges. And one of those challenges is pain, when they undergo the crises. So, it's because of that background that we ought it's important for us to come and highlight the important issues that these warriors can use to cope up with life. And to be straightforward, I'm going to start on them without wasting a lot of time. These people living with sickle cell disease, they can cope up with a healthy life, and they can really do well if they go with these things we are going to discuss about. These are going to be don'ts and the do's, the one that I'm going to discuss. When I say don't do this, it means if you avoid that, chances are high that you will live happily without getting experiencing these crises that these warriors always get without going into these crises. So these are the things that we going to put across for these people living with sickle cell disease, be it a child, be it an old person, can use to cope up with life. And one of them is don't be dehydrated. You get my point. Derek, you get my point. Uh, I'm telling them to keep hydrated. What does that really help us? As someone living with sickle cell disease, we know that these sickle cell red blood cells, they are always hard to move in our blood vessels. So once someone is dehydrated, there are higher chances that this person will go into crisis. the one we call sickle cell crises, and the person will have pain, will have all those things, you know. So it's important for this patient to keep hydrated. Always take a cup of water. If I can say, let every day take at least 4 liters of water for old people, you know. Then for children, at least as a parent, ensure that these children are fully hydrated. Avoid that because this can help our blood to move well when these patients are not what? Dehydrated. Then another thing I'm going to talk, as someone living with sickle cell disease, you don't need to be stressed because we know stress can cause you to go into hypoxia or a state where you don't have enough oxygen, and you find that your blood cells are always don't cope up with the oxygen stress. This person is stressed, it will also increase the chances of having these crises, and that will be bad for our patients. So we encourage them always avoid stress in your life. You know, avoid high temperatures. You know, avoid cold temperatures. Those extreme temperatures. You know, when you're in cold temperatures, your body increases the metabolic rate, so you demand too much, and your blood cells cannot cope up with demand, you know. So we encourage you to stay at a moderate temperature where your red blood cells can cope up, and you live a very good life without experiencing these crises. So that is very important. And you should altitudes, because we all know that the higher you go, not only the cooler it becomes, but still in levels, concentration at those high altitude goes what? Goes down. And these patients, their red blood cells cannot cope up with the oxygen uh, saturation at that level. So we encourage them to stay at low altitude so that they don't go up there and get desaturated, which can take them into those sickle cell crises. Another point I can talk about is eat balanced diet. You know, when Derek, when we talk about eating, many people don't understand. Many people think when you go to Cathay Javas and buy chips, chicken, you know, you're eating well. No, let these patients encourage these children to eat vegetables, to eat fruits, eat lean proteins, because these things can help them to have a healthy body, you know. They can help them to fight infections. And we know infection is one of the stress things that these patients what? Face. You get the point, Eric. Encourage patients living with sickle cell disease. You are warriors and you can really fight. People living with sickle cell disease, they should always adhere on the medication that are prescribed with their doctors or health providers. You know, these patients, they are always given some prophylactic antibiotics like penicillins, you get folic acid, you know, pain medications. So once you adhere to the guideline given to you by your doctor, you're going to live a good life. So I encourage these patients, I encourage mothers to these children, please keep them updated on their prescription given to them by their doctors. You get my point, Derek. Derek,
Yeah, I'm there.
okay. I also encourage them to go for regular checkups. You get, always go for regular checkups and follow-ups, because when you go for checkups, you will be able to identify the complications that comes with this disease. It's just because we have limited time, we cannot discuss the complication that comes with sickle cell disease, but there are really a lot. And to mention but a few, stroke, you know, because these cells, they block the blood vessels, they can block blood that goes to the brain and you get a stroke. You know, leg ulcers, They can block the blood vessels that goes to your legs, and then you don't get blood supply to that leg, and the leg become get those ulcers. You get the point, Derek. So we always encourage these mothers to go for regular checkups, to take these children for regular checkups, because these children are liable to becoming anemic. So when you go, they will check their HB levels, and then they know them how much they have. They will check their eyes and then know if their eyes are still doing well, because all those are what? Those are complications that these patients will always face. You get there. We also encourage the mothers or people living with sickle cell, please stop smoking. Stop smoking, stop drinking alcohol, Derek. Because smoking also deprives oxygen because it has substances like nicotine. And our carbon dioxide has high affinity for oxygen. And these cells for these patients living with sickle cell cope up with that demand you get. So it is important if you want to live healthy with sickle cell disease to avoid smoking, avoid taking alcohol. You get my point, Derek?
Yes, sir.
Yes, another point I would like to discuss is that always do some regular exercise. It's not that when you have sickle cell disease, you don't do exercise. Some parents are restricting their children to do exercise. What I would say is that choose the low impact activities that are easily on your joints and your muscles. You get the point. Don't over exercise because we know when the child over exercise, the demand for oxygen will be high. And we know their hemoglobin cannot cope up with that demand. So allow these children to exercise, but activity that they can really manage. You get my point, Derek. They don't have to over exercise, you know. And as these children are exercising, please ensure, or when someone living sickle cell disease is exercising, please ensure you avoid trauma, because trauma at the end of the day can lead you to have bleeding. And when you bleed, you're going to go into a crisis. You get the point. I will also encourage people living sickle cell disease to have enough sleep, Derek. Overwork makes me a dull boy. You get the point. So when these children living with sickle cell, they should have enough rest so that they are not stressed, so that they are not fatigued. Because when you're fatigued, you will not work and you will not do well. Stress will just make you to go into crisis and you will not really enjoy the life as a person living sickle cell disease. We want to see you happy, you know. We want to see you happy and we want to see you coping up with life. It's very possible to have a higher life expectancy with people living with sickle cell disease, provided what to do. That's why I and you we have come to make this clear. I will also encourage people living sickle cell disease, please educate yourself about your condition. It's very important. When a healthcare worker is examining you, ensure you also understand it closely, because this will help you to understand the condition and know how you manage yourself. You get my point, Derek? So I encourage all people living with sickle cell disease to educate themselves about the condition. Let them know what they are living with, because it's after you knowing that's when you'll be able to take care and live happily. You get my point, Derek? I will also encourage mothers, especially with children living with sickle cell disease, you get, to ensure that these children get vaccination up to date. You get what I'm meaning? They should get the pneumococcal vaccine, they should get the meningococcal vaccine, they should get the influenza, because we know if this child wasn't vaccinated, he will be attacked with a lot of infection. And we know he's already having sickle cell. So we don't want our child to have that problem. So I would ensure mothers to ensure that the children, their vaccination schedule is up to date. That's very important. I also want to encourage people living with sickle cell disease, please be away from sick people. I'm not saying that neglect, but there are those conditions that are infectious. And you know your immunity is always down. You get the point. So you don't have to associate with sick people. Be, you know, because malaria can get you, and we know how detrimental malaria is. Please stay away for the safety and for the health of you. Also encourage mothers or people living with sickle cell disease to always monitor their oxygen saturation. And if I would say every patient or every person would buy a pulse oximeter at home, saturation, because we know they always experience anemia. You get, because of the breaking down of those so-called red blood cells. So because of anemia they experience, we always want them to monitor their saturation levels because we know what is happening in their system. You get a pulse oximeter so that they can monitor their oxygen concentration all the time because of the serious complications that come with the low oxygen saturation that they always experience. I also want them to take care of their mental health status. Derek, you know what it means to live with a chronic condition. Living with a chronic condition is so disturbing to our minds. So yes, so we always want them to take a step and monitor their mental status. If they are feeling depressed, they should see a counselor and then talk to them. You know, counselors are there in hospitals. This will make life meaningful. You don't have to opt for other means when you're stressed. You get my point, Derek. I also encourage people living with sickle cell disease. These warriors should join the joint support groups because Derek, it is in these groups that you will get the emotional support that they will share with you the cope-up mechanism. And there are some people there in those groups, they know very well how the disease works, you know. So they will really help you and support you understand the condition very well. And even emotional support, which I told you, mental health. So they can easily talk to you and understand your condition. So always join those groups, you know. Another point I would talk about is that they should always have a journal. Keep a journal, you know. Keep a journal of yours, which is having symptoms you experience, which is having treatment you experience, which is having the symptoms you experience, you know. This journal will help the health worker to monitor the progress of the condition and you will be able to change your treatment plan. And lastly, Derek, I want to talk about these people living with sickle cell disease. Please, warriors, be prepared for the emergencies. What do I mean? We know that these people always experience these severe pain, these crises. So I would encourage mothers and people living with sickle cell disease to always be prepared for emergencies. What do I mean? Have pain medication with you, have oxygen at hand, and have plans for your transfer, quick transfer to the health center. Derek, with the few remarks, I beg to end there. I just want to thank my viewers. Thank you for watching. Thank you for following. Follow for more. We are really happy to be here and to discuss about sickle cell disease. We want to see that we have a sickle cell free generations. That's why we are on this campaign. We're on this campaign to ensure that we talk to people. We have realized people don't understand these conditions. And we went to medical school So we can use this knowledge. This knowledge is free. So when we share this knowledge, when this happens, it means this. So that helps that person to. So with the few remarks, I want to thank our viewers, Derek, for tuning in, for following viewers, and I beg to end there, Derek. Thank you so much.
About, and I would like you to express it more.
Which one, Derek? Fortunately, I can't hear you, Derek, very well.
The point of
The issue of vision. Your network is disturbing you, Derek.
About the issue of nutrition living with sickle cell disease. How
Ye-
can we nutrition?
Okay, nutrition with people have talked about eating the balanced diet. You know, that food that contains all food values. So you have just to balance. Sometimes it's important to visit a nutritionist, you know, to help you to cope up with the feeding. But what I can say, you need to eat protein. Like I would encourage all people to visit the nutritionists and talk about them the diet they can cope up with. Those people can do it better.
Yeah, Dr. Joet would like to know if people have questions with you.
Are there
if
some people
someone
asking
wants to
questions?
contact you privately, how can someone get you?
Like
Oh, I-
you
uh,
know, they will listen in the comments.
yes, they will read them in the comments, by the way. Yes, let them leave questions in the comments. We can answer them in the next video, and we can share our contacts still. Your network, Derek, has disturbed you a lot. I don't know if mine is disturbing you. Yes.
Thank you so much for making it. I would like to thank you so much. I wish let us stop here.
Thank you, viewers.
You are okay.
Okay.